He's had it for about 3 weeks.
Hi, Asia.
He's noticed some more
Hi, how are you?
I'm doing well. My name is Yanni. I'm your level 1 student nurse today.
Okay.
He's also noticed some
And
inconsistencies in
I
protocol.
wanted
He's
to
had levels of 300s,
get report from the
for the past
patient,
5 days,
Mr. Light.
All right, well, right now I'm taking care of Mr. Light. He's a 67-year-old African-American male. He's had type 1 diabetes for over 20 years.
His vitals are all within normal
He came to us
limits.
yesterday afternoon complaining
His
of a
last action check was
sore
at
on his
2:30.
right
It was
heel
2:42,
that was
so
not
it's a
healing.
little bit on the high side.
So we go
Otherwise,
ahead
he
and
didn't have any
diagnose it as a
chest pain,
diabetic
any
ulcer, stage
edema.
2. It's about 5.5 centimeters long and 2.5 centimeters deep. Right now we're just irrigating it with normal saline twice a day and keeping it dry and covered. His also complaint was of hypoglycemia uncontrolled for the last 5 days. It's been continuing in the 300s. So we've been giving him fast-acting insulin along with the long-acting insulin to kind of get those levels under control. His last blood glucose was 290. So we're going to be giving him Lispro 6 units based on the citing scale that his provider, which is Dr. Phillips, ordered. Vital signs right now, temperature 98.4, respiration 18, blood pressure 80. Blood pressure is a little elevated at 145 over 72. He's on Lemire and it's 95%.
And his A1C is currently 6.5.
All his labs were within normal limits.
So are we medicating him at all today?
His A1C
Yes, the doctor has ordered
was
insulin
higher
20
than normal
units
for him,
sub-Q.
but it's still within normal limits. It was 6.5.
So we're gonna go ahead with that.
Provider's office was 5.2.
And also
So
there's
definitely is a
wound care
elevating trend
consult
going
that's
on,
been
so we're
ordered.
trying
That's
to
gonna be
get that under
tomorrow
control for
morning.
him.
And
That's
yes,
about
like
it for
said,
him.
PRN
I mean,
payments, and we
he's
have
full
some other
code.
medications later tonight.
What type of insulin does he get?
He has
gets
a moderate risk
insulin,
of fall, and he
the
gets around by himself pretty
50/50,
easily.
which is a mix.
We're getting ready to
the
pass
regular
breakfast
insulin
trays, and
and
with this
insulin.
insulin, since it's such a fast-acting insulin, we want to make sure we have some food
It's-
available. Do you have any questions before we go
Yeah,
in?
I kind of want to know what it does to the body. I also want to know
How would
like,
you,
when you give it, when you wouldn't.
So
Why
basically the
specifically is
method,
this
the
client
action
receiving
of the
this
medication
medication?
Well, since he has type 1 diabetes, he doesn't produce insulin.
which is
So
going
this is
to,
an insulin for him, and it's going to help lower his blood glucose, and it's also going to stimulate hepatic uptake. So you can go ahead and
70 to 120. This
break
particular
down
medication
glucose.
has an
And,
onset of benefit, but it peaks within about 2 to 12 hours.
What action does the
and
medication
duration
have
is
on the
24
body?
hours, so
It
it's
lowers
kind of
blood
full
glucose.
coverage that medication.
So with that
So
being
for that,
said, we
since it
always
lasts so
want to
long,
make sure we
are
check
you
for
monitoring
hypoglycemia.
the
Some
glucose
symptoms of hypoglycemia is being
throughout, or
diaphoretic,
His-
having that cold,
his
clammy
order
skin.
is,
Also tachycardia, so we want to make sure we check his pulse and his
Okay.
heart rate,
Okay.
because those
So
are
as
some side
far
effects
as
of the
this
drugs we
goes,
want to
I
monitor
know you
for.
just taught me on
That's why it's
allergies,
very
just
important to
fine.
give with food, especially
in the
carbs.
hospital.
And when should you question administering this medication? Does the medication have a therapeutic serum level?
Yeah, whenever the blood glucose is low, you typically don't want to give the insulin because, again, that could put the patient at risk for developing hypoglycemia and possibly going to a diabetic coma. So that's when we would consult the physician and see if we go ahead and hold
And also his insulin dose
the insulin dose.
due to stress and due to illness.
And which vital signs must be monitored?
So we definitely want to monitor heart rate, pulse, O2, because it can cause depression with respiration,
Okay.
blood
What if
pressure,
he
basically all the vital signs.
gets too low?
Which physiological parameters should be monitored when the medication is being administered?
You definitely want to make sure the patient is alert and oriented. He's alert and oriented times 3. He's cooperative. You want to make sure his blood glucose level is above 150, because that's when he actually needs the dose.
We don't want him to. Side effect is.
That's basically it.
adverse effect is
Okay.
hypoglycemia.
And what are the side effects and potential adverse
It's not a rapid
reactions?
vaccine, but it's
Hypoglycemia is a big one,
throughout the day, so you
so it's important that you know and know how to assess for the signs of hypoglycemia, which
So,
includes nausea,
all right.
vomiting,
We're going to administer the
diaphoresis, being
medication?
cold and clammy, just being very weak and confused.
How will you know the medication is effective?
We check his blood sugar every 6 hours, so as long as it's in it, between under,
So it's my interest.
150
I'm gonna be
blood
your
pressure,
nurse today.
we're okay.
How are you
Okay.
feeling?
Feeling all right.
All right, so
Thank you.
we're gonna go ahead and give the medication, okay?
Okay, thank you.
Mr. Light,
Yes.
is it okay if I come in?
Yes.
So it looks like your last glucose was 242, so we're gonna, the doctor's ordered some insulin.
Hi, Mr. Light, my name is Asia. I'm your nurse.
Okay.
And could you tell me your name and your
And we went ahead and gave you your food tray.
5, 10,
When we checked your blood sugar, it was 290, so you're due for 6 units of insulin.
Okay. Do you have any
So I
questions
want to
about
go
the
ahead and
medication?
give that, okay?
Understand what the.
And do you take this at home?
Yes.
Where do you
Usually, yeah.
inject it at?
I would like it in my abdomen, please.
Okay, so it's important that when you do at-home injections, that you clean first with soap and water if you don't have alcohol available. And it's also important that you rotate the injection site. So if you do one side of the abdomen, you may want to do the other side another time.
Okay.
You can also do the back of the arm where there's some fat there. And then the other one. So every month or so, you just want to make sure you rotate the injection sites because there could be some fat accumulating under there. And it can kind of inhibit the insulin from working.
Okay.
Okay?
Well, yes, I would just pretend that I have an alcohol pad.
Do you need me to run and get some from the refrigerator? I'll be right back. I can get
So
some
it's
for you.
important that you check the clarity of the solution and the expiration date before you give it. And you also want to check it against the bar and make sure you're getting the right formula. And this is insulin
That's how
restored,
we're
giving,
giving,
you know,
had
6
wanted, some teaching as far as diet. So you're, looking at as far as the diabetic
Right,
diet.
can you give me your name and date of birth?
Glenn Light, 11249.
I mean, calorie number is important, but it's probably more important is carbohydrate counting. Carbohydrates are gonna get your main energy source throughout the day, so you wanna make sure you eat, a variety of foods, but you also need the right.
Can I scan your armband again?
Okay, yeah, I tried sticking to it, and over the last like 9 months or so, I haven't been as diligent as one probably should.
I brought some education for you, it's gonna talk about,
Perfect.
as far as things to look out for hypoglycemia, also foods to avoid, like you wanna avoid the trans fats, regular sodas, sugary juices, sweet candy, unless you're having like a diabetic, like zero.
And also, y'all want to make sure you wipe it with the top of your bottle very good with alcohol.
Okay.
Thank you so much.
And I just inject 6 units of
So,
air
we want
into the
to-
bottle.
Okay.
Clean off the top of this medication. Okay, so we ordered 20 units. So I'm gonna draw that back.
And how's your diet at home, Mr. Light?
That's good.
Oh, okay. You're actually on a 1800 calorie diet. I'm just showing your chart that over the last few months you haven't really been declining yet. You want to make sure that you eat a lot of greens and vegetables. You do include carbs in your diet, about 45 grams per meal.
Okay, so that's, so
Would be,
going to go ahead and administer your
okay?
medication. I'm going to go 2
You also want to make sure you incorporate some exercise into your routine. Nothing crazy, but just if you can walk 30 minutes a day, that will also help get your levels of blood sugar under control. Okay?
And then just put this in my sheriff's box. Okay, so you don't want to massage that area or anything. Just go ahead and let me know if you're feeling any kind of extra tenderness or anything like that. Side effects of this medication could include redness or pain at the injection site, but I don't anticipate anything.
Yeah, sometimes over the years I've gotten some bumps and bruises everywhere, it kind of hurts. I'll let you know.
So I completely forgot.
Okay, Mr.
Scan your
Light.
bracelet.
Um,
To scan the medication.
all right.
Awesome.
But aside from
But,
that,
have you
you did a
been
pretty
seen
good
by a
job.
wound care nurse yet?
Yes.
Did
I'm
she
so
teach you how to
used
change the bandage properly?
Yes.
Okay, just to prevent injury in the future, you want to make sure you test your water, maybe a thermometer, because a lot of times you may not be able to feel the sensation of the water temperature may be a little off, so you actually may be burning yourself by putting your foot in too hot of water, because you have a decreased sensation. You also want to keep it warm and dry, don't apply any lotion in between your toes. And make sure you wear shoes that are well fitted, not too big or too loose.
For carbohydrates are like
Okay.
complex sugars, so that's what I would make sure that you say you need a small amount of carbohydrates. And when you check the blood sugar, it's 15 grams, it's the rule of 15.
Okay.
Yeah.
15
Do you
grams
have
of
any
glucose,
additional
check your
questions
blood
for
sugar.
me?
Good.
All right. Well, here's your
Which
call
is like
line.
your lightsabers and
If you need anything, just give us a call.
Small
And
juice.
any further questions?
I didn't think nothing for you said something.
All right, thank you.
Yeah, everything's in the cart. You just need to make sure you have alcohol.
So we need to go find more, yeah.
Thank you.
Thank you.
So then I guess when you do
All right, did you have any questions for me?
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yeah, I just wanted to make sure, see where she was injecting it, and if she understood the levels that are, make it abnormal for her glucose sugar, which he did.
And did this information affect your decision to administer the
I
medication?
just administered it in a different spot, because I did tell a patient about the fatty tissue that could develop under the administration site, so.
Did this information affect your how you administer the medication?
Yeah, I administered it in a different spot, and I made sure I checked the sugar to have an accurate dosage.
Okay. Thank you.
You're welcome, thank you.
You're welcome. Thank you.